table. My question for Stats Canada relates to the comments made at the end by the witness around the need for granular, disaggregated information that allows us to understand in greater depth the impact of the crisis on different demographics. And I'm particularly interested in the intersectionality of race and gender, race and youth, race and unemployment. I know that Manitoba is collecting data. I know the city I live in isn't collecting race-based data. When and how will Stats Canada be able to present a fuller picture of the impact of the crisis based on racial minorities? And
maybe I can start with answering the second question for Statistics Canada, and then my colleague Josée will also speak to it specifically from the Labour Force Survey perspective. So very early on in the pandemic, after we had launched our first web panel on March 29th and our crowdsource on April 3rd, we heard we needed disaggregated data. So what we quickly did for the second wave of the web panel, as well as the crowdsource, we added questions that are key indicators to look at disaggregating the data, and that included immigrant status, population groups, so visible minority, but ability to look at Blacks, etc., and Indigenous, First Nations, Métis, and Inuit. So those questions have been added to both the web panel and the crowdsource. The first crowdsource we did, as I said, we didn't have those variables there, but we did collect postal code. And out of the 240,000 Canadians that participated, the vast majority gave us their postal code. So we're looking right now with our methodologists to overlay those data onto maps. So at least we can maybe look at smaller communities where there's high immigrant populations or visible minorities. So we're seeing what we can do there to be able to disaggregate the data. But I'm particularly anxious to see the results of the second wave of the crowdsource that we launched that was looking at mental health. To that crowdsource, we had about 46,000 respondents. It was in the field for a shorter time. We're trying to turn these over about every 2 weeks, but still 46,000 should yield good results, at least at the national and regional levels. Again, those indicators are there. So again, we're just processing those data now. We'll be releasing them in the next week or so, and hoping that we will be able to look at immigrant, the population, different population groups, as well as Indigenous. So again, I'll have to promise these results to the committee once we get those results. But I'll let Josée speak specifically on the Labour Force Survey.
Thank you, Karen. Maybe I can add to that the need for more local and granular data in terms of the Labour Force Survey. So if you're thinking of employment, unemployment, it is a need that is critical to our users. So in the last year, we've been working with our partners in the provinces and the territories to see if we could be using some other administrative sources of information, using some statistical techniques to be able to estimate those indicators at a more local level. Right now, we are producing our indicators at the level for 76 regions. Those are the employment insurance regions. I also wanted to say that on the Labour Force Survey, we do not collect information on visible minorities. We do have information on immigration status. We do collect information for Aboriginal living off reserve. However, regarding the visible minority status, we do have a project currently in progress to be obtaining information from other sources of information and integrating that to the Labour Force Survey. So in the future, we would be able to report on that. And very recently, we've engaged with the City of Vancouver, who approached us for the need to have information from the Labour Force Survey for the City of Vancouver itself. Again, the need for more local data a little bit at a more detailed level than what we currently produce. So we've been working on that as well, and looking at the 2022 Census Metropolitan Area CMAs, as we call them, for the rest of the country.